Royal Highness, Eminences, dear colleagues, distinguished audience, I'm glad to be given the floor to talk about health and health care, and therefore I would like to say thank you to the organizer of this event. Unfortunately, not many people are here anymore, but health would be the excellent topic for digestion. So, well, let me start with a proverb, a Chinese proverb, which says, wealth means a lot. Contentment is even more important, but health means everything. And therefore, it is not wondering and not surprising that everybody is striving or looking and striving for health as a universal desire of highest priority. Therefore, everyone, every state, and every nation is interested in developing the best possible prerequisites and fundamentals for ideal healthcare system and healthcare management. Due to the different initial positions of various countries, regions, and cultures, the stages of development of the corresponding healthcare systems do vary tremendously. Over the past decades, the development of the individual countries proceeded differently as of diverse reasons, and thereby the different healthcare systems had even been evolved variably. Within the last 200 years, Switzerland has experienced an extremely positive development in the provision of medical services and goods based on a constantly stable political and economic environment. This has led the country to become one of the leading nations in healthcare worldwide. On the basis of these prosperous trends, many medical and therapeutic procedures have been invented and developed, and Switzerland has become an attraction for patients from all over the world. Switzerland not only became attractive for internationals due to the economic and political reliability, the high standards in medicine, but also due to the fact of the multicultural, multilingual society, which is and always was a prerequisite for hospitality. However, it has not always been like this. Switzerland, as well as all Europe, has undergone difficult times during Middle Age, as it also already has been mentioned this morning. Back then, amidst chaotic religious disputes, any development had been prevented and made impossible. Research, science, and healing were vilified, and a big part of the medical knowledge about cure, about treatment, and healthcare management had been preserved and further developed in the countries of the Middle East. Consequently, it is shown that the requirements of a prosperous healthcare system can only be assured in collaboration beyond countries, language, and cultural borders. Everybody agrees that sublime healthcare systems shall be reached. Nevertheless, the parameters to determine how the healthcare management's quality is or shall be are presumably not clearly defined. In order to provide some inputs as a basis for discussion, several comparing statements between GCC countries and Switzerland may be outlined as follows. And therefore, I would outline the most important aspect of healthcare system is the availability and therefore the access for inhabitants of a country to medical healthcare facilities. The first chart just shows bluntly a few figures of hospitals comparing the number of hospitals from GCC countries to Switzerland. It doesn't say a lot, but at least it gives an impression of how many hospitals are existing in Switzerland compared to GCC country, considering and knowing that Switzerland has only about 8 million inhabitants. The second chart gives further more information about the healthcare capacities. We have on one hand Switzerland with 5.2 beds per 1,000 inhabitants or population, compared to an average of 2 in the GCC country. It's just a figure. However, this does not state anything about the correct number of inpatient facilities, as the steadily reducing number of hospitals and beds in Switzerland outlays that the overcapacity is as inefficient as undercapacity. Furthermore, important for the access to medical services is the form of individual health insurances. Since most Swiss inhabitants would not be able to cover all costs of their medical treatments, they depend on a health insurance based on the principle of solidarity. 100% of the Swiss population is compulsory insured and has the possibility to be treated in medical facilities of their choice, whereas only about 10% in the whole GCC area are covered by healthcare insurances. Therefore, a national health insurance structure is required in order to allow all citizens the access to an adequate and appropriate medical supply. The Swiss healthcare system is similarly structured to the systems in the GCC countries, based on public, semi-governmental and private service provider, even though the proportion of Swiss private service providers varies to the share in the GCC. Nevertheless, there is no right or wrong when it comes to the amount or number of private services in a country's healthcare industries. Different healthcare systems show diverse characteristics in the mix of private and public services providers, like, for example, the UK, which is mainly structured publicly, whereas the US has organized its healthcare system primarily on a private basis. Regarding the share of private service providers worldwide, a tendency of convergence appears. That what means an even ratio of private and governmental medical service providers might be the ideal solution. It has been assessed that medical service provision is expensive, independent from the healthcare system structure. However, differences in the willingness and or ability of individual countries to actuate costs can be identified. In Switzerland, the aggregated costs of healthcare system are about 50% higher than in the whole GCC. In this chart, it is shown that Switzerland spends about 60 billion a year just for the healthcare provisions, compared to about 40 million all over the GCC. The next slide shows us the expenditure, healthcare expenditure in percentage of GDP. There's about 10% of the expenditure is from the total GDP is expenditure for the healthcare, compared again to the GCC country, which is between 2 and 4%. So the percentage, therefore, is much lower. And also there, it is not said which is the right way and which is the right way done. The third and last chart shows, and this difference is even more tremendous if we see the expenditure per capita. The expenditure per capita in Switzerland goes over $8,000 a year, compared to the GCC countries, which vary between $200 and $1,500. So there are really big differences. But there as well, it is not the question to spend as much money as possible. The question is to spend the money as efficient as possible. There would be many more parameters in order to evaluate the healthcare system, like, for example, the number of trainee positions for medical and paramedical personnel, or also the number of medtech and pharmaceutical companies and their new products as well as the university outcome in research and development. Nevertheless, a healthcare system can only be assessed rudimentarily with the mentioned parameters. It is the health of each individual person as well as the individual evaluation of its own medical conditions that determines finally the quality of the healthcare system. Furthermore, the average life expectancy, which is about 10 years higher in Switzerland compared to the GCC countries, at least at the moment, may be evaluated, or, on the other hand, the mortality and morbidity rate related to the individual disease groups as an indicator for the assessment of a healthcare system. In conclusion, it helps sparsely in highlighting new solution approaches, and it can be retained that Switzerland and the GCC countries, despite different requirements and distinct stage of development, face in some areas similar exigencies, however, in different peculiarities. These issues include scarcity on financial means, contingency of qualified medical personnel, or challenges in managing new society diseases such as diabetes, obesity, cardiovascular diseases, or cancer. Therefore, I'm urging for an ongoing cooperation in the different fields in order to improve both healthcare systems, the one in Switzerland and the one in the GCC. With this in mind, I would like to thank you for your kind attention.